Hi, and welcome to HIMSS TV. I'm Susan Morse, Managing Editor for Healthcare Finance News. We have a great session here today talking about the new CEO Coalition. I'd like to start off by asking, how did this coalition come about, and how did Vocera get involved?
Susan, great question. During the pandemic, I think we all saw firsthand all the psychological, emotional, and physical dangers that our frontline caregivers really subjected themselves to. And we realized that there's a need for a renewed commitment to frontline safety for our frontline workers. And Vocera's mission is all about protecting our frontline caregivers and improving their lives for both patients, families, and caregivers. And so we just felt compelled that we wanted to do more. And Dr. Duffy and I sat down and started talking about, what could we do to have an impact? Vocera has over 50 nurses as employees within the company, and nurses are our heroes. We're in business to support nurses and to make their lives better. And so we sat down, we talked about it, and we said, what real action could we take that would have an impact? And Bridget had the idea of reaching out to some of these leading health system CEOs across the country to see if they'd be interested in collaborating with us. And we created this group of a very diverse background group of CEOs from across the country. And we were really pleased to see that we didn't have to twist their arms. They all really just kind of jumped on board, and we're really excited to get involved in this movement. And we're really recognizing the importance of this work. And so we created this declaration of principles that the CEOs were able to edit and work on together and sign. And we're really excited about the work that we're doing moving forward. And it's so aligned with our mission, and excited to talk about it today.
And Janice, there is a declaration of principles that Brent referred to, and I'm wondering if you can talk more about that. I understand it has 3 pillars to redefine safety in healthcare.
Well, thank you, Susan. And yes, the principles and pillars are really foundational to the work that we're doing. And the CEO Coalition's Declaration of Principles really expands the definition of safety to include safeguarding psychological and emotional well-being of team members, promoting health justice by declaring equity and anti-racism as core components of safety, and ensuring physical safety, which includes a zero harm program to eliminate workplace violence, both physical and verbal. Throughout this pandemic, we've also been challenged with issues of fatigue and burnout by the healthcare workforce. And we know that workplace violence, burnout, and disparities existed long before the outbreak of COVID-19. The pandemic has, however, really exacerbated these factors, contributing to the increased stress, and created an environment of really unprecedented stress, and exposed the impact to us of systemic inequities and racial injustice on the well-being of our healthcare team members. So as we were discussing this and bringing it all together, we really believed a renewed and expanded definition of safety was needed to restore trust, recruit and retain our valuable team members to the healing professions that they chose, and enable care to be provided with the greatest skill and humanity for our patients and families, and at that same time, ensure the well-being of every person working on the healthcare team.
Yes, well, as you said, COVID brought to light a lot of these inequities and racial concerns that existed before. But Dr. Duffy, I'm wondering if you can explain how is this a component of safety for healthcare workers?
Well, I think it was fascinating to meet and talk in depth with these 10 CEOs and executive members of their teams. And all of them said that my teams cannot be safe. Physically and emotionally is one thing, but they cannot be safe unless they're free from health injustice. And it was at the time with the murder in Minneapolis going on, and yes. Andrea Walsh is one of the CEOs who leads Health Partners there. And she said, my people are having to go to work with the National Guard parked outside. And unless they're free from, racial injustice and a bias of any type, they are not truly safe. So it was really, for me, just a profound revelation that our definition of safety to date has not been truly complete enough. And as you said, the inequities, we also talked about the invisible workers in our institutions housekeeping, food service, and even amongst team members, that these racial injustice and biases still exist in our health systems. So our intent with this coalition is to create a grassroots movement to make this pillar around health justice such a critical component of safety.
What else did the pandemic bring to light about the workforce, and in particular workforce safety?
Well,
So, I think we saw many, critical things during the pandemic. First of all, how essential our healthcare team members are, and the reliance of our entire community on the healthcare system to be able to effectively respond to a pandemic. And we saw that at unprecedented levels, throughout the globe. We do know, though, that, how driven and compassionate our healthcare team members are in stepping forward, providing care, even when we knew early on in the pandemic, the risks to them were uncertain. And we really saw them really, choosing to do everything they could to provide that patient care. We do know, though, that takes an emotional stress on people, and the effects of those stress and living with that uncertainty and seeing, so many different things that we saw in addition, tremendous loss and the impact of that on people personally. So we do feel, that's why the time is right to do this. We've just weathered really an incredible storm, and we really need to do something to really bolster the resiliency so that we can be better prepared in the future.
I think I would just add to that, Susan, that never in my career did I witness fear in the eyes of my colleagues. To go to work and have fear that they would get infected and then go home and infect their loved ones. And as one of my colleagues said, never would you think that you would have to get contaminated to communicate with your colleagues. And this fear of not having the right protective equipment or the ability to communicate safely with your colleagues is something I've never experienced in my career as a physician. And also, never did I think we would strip loved ones away from each other with no ability to communicate. And nurses did amazing things, from putting signs up in windows to the parking lot and holding phones up, to connect patients to each other. So these are the things that I think made us as a coalition have a sense of urgency to go faster. And our thinking was that we could do more together faster if we brought together this core group and then enlisted others to sign on.
I'd like to read from the goal of the coalition, what you have on your website. It says the goal is to take action to protect the well-being of essential team members and ensure they have the systems, tools, technologies, and resources they need and deserve to feel safe at work. And I'm wondering, what form is this action taking? And Brent, do you want to start with that?
Sure. Yeah, it really starts with our collaboration with the IHI. We're partnering with them, and we believe that they're probably the best situated to be able to really lead this effort across the industry. That's really the first step. And then obviously the involvement of each of the CEOs who's part of the coalition and their supporting teams. This is really not just the individuals at the top of these organizations, but really down through the organizations. We're getting tremendous support from a variety of different people within the CEO Coalition organizations who are really committed to action. And as I mentioned earlier, this is something that's not taking a lot of pushing. There's just a natural momentum here where people are super excited to get involved with this. They recognize that this is a really compelling and important activity. Just to build on one of the things that Jonice said, we actually created a theme within the company this year around never more essential. And I think that the last year has really highlighted the fact that our frontline caregivers have never been more essential, and our role in supporting them has never been more essential. And so I don't think it's going to take a lot of pushing to make this happen. There's a lot of natural momentum. Vocera is going to be investing to support this effort, but that's really not the focus. It's really about getting a group of people together who are concerned and committed and are willing to make the changes that are necessary in order to make this a successful effort.
We hear a lot about the stress on the workforce, and in particular about nurses and nursing shortages, and how women in general in all occupations after COVID are finding it hard to go back to work, some citing childcare issues. Is the coalition addressing this factor of stress in staff and from all levels?
Yeah, so I can definitely start on that. Yes, and you have really hit one of the main points of concern, right, with our workforce. And there are many issues of inequity that persist in healthcare and society at large based on race, gender, sexuality, class, and a number of other factors. The CEO Coalition is really interested in pursuing equity for all healthcare team members. And we know these are big issues, and we will be working with a variety of others to really identify an initial set of evidence and experience based opportunities that we can look at related to this. And we're also, one of our work efforts is really how do we really amplify the message? How do we partner with the right organizations so that we can have the greatest impact in pursuing equity and safety in all of its forms for our workforce?
Yeah, I think I would add to that that burnout existed before the pandemic, and that post-COVID PTSD is real and will exist, and that if we don't do something and something quickly, our nation's healthcare workforce will be crippled because we will have a shortage of staff, and in particular, women who fill many of the frontline roles in nursing and ancillary staff that will leave to go into other professions. So this is a key part of our declaration that we want to address this, and in partnership with IHI. In fact, we're pretty excited about their work because everyone was committed that this declaration could not sit on a shelf. All of us really have a bias to action. And if there's anything, there's nothing good about the pandemic, but what has happened is rules for rules' sake and bureaucracy has gone away so that we can innovate and do things faster. So it's our hope that we will together take on these issues of disparity, in particular with women and people of color, through the movement of this coalition.
Yeah, and I would add too, we've also recognized we need to provide those needed technology tools and protocols and resources to continue to safeguard our teams. And I think there's a lot of opportunities going forward in how we really do that and leverage that for our workforce.
One of our CEOs, Susan Ehrlich, CEO of Zuckerberg San Francisco General, said people that work in safety nets, and like Jonice, they have large behavioral health programs and inpatient and outpatient mental health. She said they just expect that they will be assaulted or harmed at work. And she said that's not okay. So the fact that we are all coming together to really take this on and have a zero tolerance for workplace violence and protecting people, I think we'll be able to do faster by all coming together.
Yeah, that's incredible, going to work and expecting to be assaulted. That's incredible. Brent, you addressed investments in this. I'm wondering, are the health systems that are involved making investments, the coalition as a whole, and what will those funds be used for?
We're still in the early days of that, so I don't think anything has been decided for sure, but I think there's a broad commitment that this is not just about creating the declaration, it's about creating action and creating change within the organizations. And we've seen tremendous support and outreach from a variety of different organizations that have seen the creation of the coalition. We're now seeing more and more members or new members who are wanting to join the effort. So I think it's going to be a groundswell of activity. I'm expecting to add more and more members to it over time. And I think the more people we get involved and more awareness we're building around these important issues, then the more success we're likely going to have.
That's still to come then, the actions that will be, can we expect that down the road perhaps?
Yeah, absolutely. We're putting together a work plan in connection with IHI, and they have a methodology that they like to follow for these change agent activities. And so they're going to be leading an effort for us that will include research and outreach and education to the members as well as to the broader public around these important issues.
And going forward, Susan, Jonice has said that because this was published and out there, that several CEOs have reached out to her saying, how do I sign on? All of the CEOs have had the same experience. So it's our hope and our dream in collaboration with the Institute for Healthcare Improvement that several of these sites will become demonstration sites where they're rapidly testing and prototyping practices around these three pillars so that we can rapidly roll this out across the country. I mean, we watched how telehealth has been around for 20 years, but overnight with the pandemic, it became adopted. It's our hope that we'll have practices quickly developed and sources of funding to support these things very quickly because of the momentum of this group.
Well, thank you, Brent, Bridget, and Jonice. This has been a fantastic conversation about the CEO Coalition, and thank you for joining us on HIMSS TV.